Hi, Ms. Dobbs. Thank you for joining me for the interview.
And thank you for having me.
Tell me something about yourself.
I'm a hard worker. I have 2 little girls, and I try to instill the same values in them as I was taught myself, with integrity, honesty, always going above and beyond, whether it's at home or within the workplace, and I carry that over.
Tell me some of your strengths.
My strengths would be that I am always trying to make sure that everything is lined up and organized. I'm extremely organized at any aspect of my life. I also always try to make sure that I'm collaborating well with the teammates around me, whether it's a teammate in the school atmosphere or in the work atmosphere. I believe in being a team player, and that's definitely one of my strengths, as well as my work ethic.
What are some of your weaknesses?
Some of my weaknesses are I like things to be perfect all the time. So when they're not, it's one of my biggest pet peeves. So sometimes you will find me organizing things overly, and you'll have to stop me because I'm a perfectionist when it comes to my work.
What is your ideal company?
My ideal company actually is Baptist, your company. I love the community outreach that you do, the nonprofit organization that helps underprivileged and families that are in need of health care get that care, and that all of the nonprofit dollars that are donated, every cent goes towards that and helping people. And that's a company that I want to work for, a company that has integrity, that thinks more about the people that they are helping than the bottom dollar, and making money and not focusing on the community. When I got into healthcare to help people and to help those people in society that are sometimes left behind and don't get that adequate healthcare. And I love that you're always trying to go out and think of new ways between fundraisers and these nonprofit organizations and helping those communities that are sometimes forgotten.
So what attracted you to this company?
Definitely your mission statement, as far as being a leader in healthcare, but also giving back, the etiquette that you give to all of your employees, mostly just the all-around company. I've been in clinicals with your company multiple times, and in your clinical atmosphere, every one of your employees just loves what they do. They love the company that they work for. They love that they are given all of the tools that they need to perform care. And the collaborative work between the teams just works so well within your company that's the company that I would love to work for.
So why should we hire you?
You should hire me because I'd be an amazing asset to your company. I always bring patient advocacy into the hospital atmosphere. I believe that the patient's voice is the nurse's voice. And you need people in your company that are going to speak up for those patients, as well as care for the patients as if they were their own family. And that's what I genuinely do.
So what were your responsibilities of your last position?
In my last clinical position, I was in a progressive care unit. My responsibilities were everything but IV. So that means inserting gastric tubes, performing multiple CNA as well as CPT duties, as far as changing bedpans, pericare, bed baths, administering medications, helping to develop nurse care plans for each patient, as well as helping the patient understand what the doctor was saying.
What techniques and tools do you use to keep yourself organized?
To keep myself organized, I use clipboards, as well as planning out every aspect of the tools that I will need to go into my place of work, and having it ready and accessible. Also making sure that when I do go above and beyond to implement new practices or research-based practices, that I've done my research and collaborated with my team.
If you had to choose one, would you consider yourself a big picture person or a detail-oriented person?
I am definitely, if I had to choose, I would say big picture person, because when looking at anyone within, as far as a patient, you have to look at the big picture. Sometimes the details go in with that, but if you don't see the person as a whole, you're going to miss a lot.
What are 3 positive things your last boss would say about you?
He would say that I am hardworking, that my bedside manner always is up to par. Maybe that I talk too much with my patients, but I believe that's how you get those finer details from the patient, is through communication and asking the tough questions. He would also say that I am always extremely on time.
What would be one negative thing that your last boss would say about you?
That I have probably OCD. He'd like to say that I was a little bit OCD with my organization and making sure that the labels pointed out, which is one of my pet peeves. I always want to make sure that if I'm going to grab something, especially when it's in med administration, that I can see what I'm grabbing to make sure that I'm giving the right dose to the right patient and the right medication.
Who has impacted you most in your career and how?
In my career, my professor, Miss Gillis at UCA, has impacted me the most. She taught me about patient advocacy, which was something before I became a nurse that I wasn't too in-depth and too knowledgeable about. And now I feel knowledgeable because of the skills that she has given me to become a patient advocate and to help those patients have a voice and make sure they get the care that they need.
And why did you choose your major?
I chose my major of nursing because I've always cared about people. I love the scientific part of it as well as the people part of it. I've always been a people person. I have bartended and waiting tables for years, and through that I have gotten my people skills.
Thank you for coming to the interview.
And thank you for having me.